Baby talk time. Welcome back, everybody. It is 8:11, and this morning's Health Watch, early is having a baby, in case you haven't noticed. For the second chapter of our series, we checked in with our expectant moms to see how their pregnancies were changing their bodies, their daily routines, and their moods. Here's a look.
You see pregnant women walking down the street and you're like, oh, I want to be pregnant. I want to have the belly. And, because you have no idea what you're in for.
You're in control of nothing, like nothing at all.
We were on vacation in November and I was only about 5 or 6 weeks along, and we were back in the hotel room and I was bleeding. The nurse who I spoke with said, most likely since it's early on, it is a miscarriage. It's crazy to not know if I was still pregnant or not.
I got swine flu. It clicked later. Oh my God, I'm pregnant, and pregnant women are dying from this.
Everyone says the second trimester gets easier, which I feel like it's a little harder, actually.
Oh, geez, the hormones.
I do have a little bit of sciatica.
Most people are like, stay in bed, prop your leg up, use a heating pad, take a Tylenol.
You feel like an old lady. No offense against old ladies, but like you just feel like you're in somebody else's body.
Sleep is getting harder.
I can't really sleep at all, which makes me irritable, which I'm not used to that emotion. 1 minute
I'm up here, and then the next I'm down here.
Kudos to my husband, because he's the one that really catches the brunt of it, because you never know what you're gonna get when you wake up in the morning.
April, Amy, and Julie are here this morning. Jessica, our other pal, her doctor had restricted her travel, so she can't be with us, but we say hi to her at home. Hello, we miss you. Also, here's our Dr. Jennifer Ashton, our resident OBGYN. Good morning.
Good morning.
So this is what nobody tells you before you're pregnant, but we're here to tell it like it is. It's not all fun and awe and amazing, as we know. Let's talk about some of the concerns, Jen. April, we know that you recently had a health scare. Is everything okay?
Yeah, right now everything is okay. I'm on bed rest and taking medication and to stop the contractions, and it was very scary and just trying to adjust to a big lifestyle change all of a sudden 10 weeks early,
So you started to have contractions. Is that preterm labor, Jen?
If it changes your cervix, it is. Otherwise, it's just preterm contraction. So luckily for April, her cervix didn't dilate, but she is on medication to try and keep the contractions at bay. And bed rest is something that, it's interesting, it's never been conclusively shown to have any real positive effects, but in obstetrics, we do it all the time because it's common sense. And we know that it certainly can't hurt. So when you talk about risk-benefit, it's not zero risk, but it's low risk and potentially a benefit.
It can't hurt, right?
It's tough being on bed rest, though. April and I were talking.
Especially because she is a mega hard worker, career woman, always on the go.
Yeah, so it's tough. It's not fun and games.
Is this pretty common, what happened to April?
It is common, but the good news again is that her cervix isn't dilating, so hopefully she'll make it to about 36, 37 weeks. And your doctor does know you're here, so you're not going to get in trouble.
No, not really. But let's get to Amy. We heard you mention that you had a little bleeding and you were convinced that you were having a miscarriage. Is that pretty common too, bleeding and thinking you're having a miscarriage?
Now, we have to distinguish between common and normal. It's not normal to bleed in pregnancy. Be very clear about that, but it is common, especially in the first trimester. When you haven't yet seen a heartbeat on the ultrasound, yes, it is what's called a threatened miscarriage until proven otherwise. And sometimes when you're so early like you were, it's not possible to tell even with an ultrasound. So it's several weeks usually of high stress, high anxiety. When you bleed further along in pregnancy, you have to exclude things like problems with the cervix or problems with the placenta. Again, it's something you want to talk to your doctor immediately for any bleeding.
Julie, you said, ugh, the hormones. We are like emotional wrecks right now. But I know that you're concerned about what happens after you give birth.
Well, yeah, I mean, my concern was that my first pregnancy, I didn't have this problem with hormones. And then postpartum, I really didn't have too many baby blues. I had maybe one day where I was crying. So I'm worried now that maybe because I am so hormonal and I have such highs and lows now, is that kind of a marker for maybe I'm going to be a little bit more have more postpartum depression.
Well, what's so important is that Julie is so self-aware that she's keeping track of these hormonal swings and communicating them, not just to her doctor, but to her partner, to her husband, to her family. The key thing is for risk for postpartum depression, it's thought to occur over 10% of the time. So really every woman is potentially at risk. If you suffer from true depression or other psychiatric disorders and they get worse during pregnancy, that definitely increases your risk postpartum. But again, it's an emotional time, and mood swings are common. What's my excuse?
That you're a woman, that you get up at 4 in the morning every day. Imagine doing that pregnant. Oh, no. Ladies, it's so good to see you again. We're all growing about the same rate.
You guys all look
Because
great.
we're all right around the same time. You're 27 weeks.
27
You
weeks.
guys, you're
31.
and I'm 26. So maybe we'll all give birth together. That'll be something. And you'll deliver.
I'll be busy.
Perfect. All right. Thank you, ladies. Thank you, Dr. Ashton.
You bet.
A lot happens early on The Early Show, weekday mornings on CBS.